Hi, this is your San Jose chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic. Hip pain or low back pain, which one is it? Technically, the hip is a ball and socket joint that is between the long bone of your leg, your thigh, and the pelvis. But more often than not, people will point to a number of different places on the back or the pelvis saying their hip is killing them when it's not really the hip at all. Hip pain can be located in the front, like the groin area, the side, the back, or even in the buttocks. The classic sign of hip pain is reproduced when you cross your ankle onto your knee and you push down on the knee here and you feel tightness, or maybe even it's causing pain in the groin area. For many people, hip pain is reproduced when they cross their legs and pull their knee towards the opposite shoulder like this over here. The hip is a very strong joint, and it's due to the fact that it's the receiving cup of the pelvis, and the round ball fits nicely into the socket. Because it's a freely moving joint, there is a joint capsule around it, and the capsule is lined with tissue that produces an oily substance that lubricates the joint, which is called synovial fluid. And when hip pain occurs, this is caused by capsulitis, which is inflammation of that capsule. And when you get a buildup of the synovial fluid, that is what's called synovitis. When the smooth, shiny surface of the ball starts to wear thin, which will eventually wear away down to the bone, that's a condition called osteoarthritis, otherwise known as degenerative joint disease. This occurs over time, and many may eventually result in the need for a hip replacement. This usually isn't needed until an individual is in their late 60s or even older, but they may not even need it at all unless they injured themselves early in life, and the wearing out of the whole joint itself may accelerate, and the hip replacement may be needed before old age. There are many studies that report low back and hip arthritis that can occur often together, and differentiating between the two can sometimes be a challenge. For example, pain can radiate from the hip to the knee, which many doctors will diagnose as a sciatic nerve issue, but the hip can present exactly the same, making it hard to determine if it's a low back or a hip-generated pain problem. That's why it's so important that your doctor of chiropractic conducts a careful history and examination. There is specific tests that he or she can perform to determine which of the two is actually causing the pain. There are times when they find both problems coexist together, making it necessary to manage both problems rather than just one. There are many mobilization, manipulation, soft tissue therapies, modalities, and exercises that are available to patients with both hip and low back pain. So if you're not sure which is bothering you, you don't know what to do, visit your doctor of chiropractic and he or she can help you out. That's it for me. I'm Dr. Will Holdsworth, your San Jose chiropractor from Pain Relief Chiropractic, and thank you for watching this video.